Can Tadalafil get you addicted? What's the best way to use it? In today's video, I'll summarize everything you need to know about using Tadalafil, the drug widely used in the treatment of sexual dysfunction. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health. And now let's move on to the video. Tadalafil is a more modern version of sildenafil, which is viagra, and both are used in the treatment of erectile dysfunction. Tadalafil is a molecule that inhibits 5-phosphodiesterase, and it acts by increasing the concentration of cyclic guanosine monophosphate, thereby causing a dilation effect, relaxing the cavernous bodies and blood vessels in a way that these cavernous bodies become more filled with blood, thus improving erection performance. In terms of onset time, it's about 30 minutes. Its peak occurs after 3 hours of consumption, and it can last up to 17 hours. Regarding the available forms of administration in the industry today, they come in 5 and 20 milligram presentations. Other forms can be compounded in pharmacies, such as tablets, sublingual strips, and sprays. Nowadays, some even incorporate Tadalafil into testosterone chips implanted subcutaneously. It's important for patients using Tadalafil to understand that it doesn't work alone. The use of Tadalafil, like other medications for erectile dysfunction, needs to be associated with a stimulus, a trigger for sexual intercourse to occur. What are the indications for treatment using Tadalafil? Besides erectile dysfunction, this medication can also be used, for example, in the treatment of premature ejaculation. When one of the causes of premature ejaculation is erectile dysfunction, the patient becomes insecure about the status of their erection and ends up ejaculating more quickly. In these cases, Tadalafil can be combined with, for example, paroxetine. Another indication for the use of Tadalafil is in the treatment of BPH, benign prostatic hyperplasia, in symptomatic patients. In this case, Tadalafil is used in a daily dose of 5 milligrams to also improve urinary flow. It's worth noting that there's currently a focus on using Tadalafil in gym settings to enhance physical performance. Initially, let me know in the comments if you would like a video dedicated solely to explaining this aspect. However, I must mention that it's not recommended for a few reasons, which I will explain later on. What is the right dose for the patient to take? There isn't a specific dose when it comes to using Tadalafil. The formulations available can be tailored to the patient's needs. The right dose will be the one that yields a good erection response. Some patients use a mixed scheme, combining daily doses with 20 milligrams on demand. Others use only 20 milligrams on demand. There are also those who use 5 milligrams daily, those who use 5 milligrams every 2 days, and those who use 2.5 milligrams. It largely depends on the patient's performance, so it's best to start with the lowest necessary dose. Regarding the decision about on-demand treatment or daily treatment, there isn't a correct decision. The routine and reality of the couple must be taken into account. What is the frequency of intercourse? How does sexual life function to adjust to the best treatment method? A very common question from patients is whether Tadalafil works for everyone. No. Unfortunately, Tadalafil doesn't work for everyone. Literature data shows that 35% of patients don't respond to this type of treatment. In diabetic populations, this percentage rises to 44%. When it comes to post-prostatectomy patients, after prostatic cancer surgery, this percentage is even higher. A smaller portion of these patients will respond to this phosphodiesterase 5 inhibitor treatment. And can Tadalafil cause any addiction to the body? Patients who use it for the long term are very concerned about this. Tadalafil doesn't cause any organic addiction, but interestingly, it can cause a psychogenic addiction. The patient can become biologically dependent on Tadalafil use, so it's very important for patients starting to use it to always have a medication tapering strategy. But is it just to stop and be without it? In fact, it can be replaced by other types of therapy, sexual therapy, vacuum pump, or some other method that stimulates your erection. Regarding the side effects of Tadalafil, the most common ones are runny nose, nasal congestion, headache, body aches, and back pain. Many patients experience these side effects in a debilitating manner, but the most serious side effect is related to priapism, which is that pathological erection lasting more than 4 hours, which if not resolved can have permanent consequences for the patient. Given the most serious side effect, which is priapism, the phosphodiesterase inhibitor Tadalafil is not recommended for a patient who doesn't need it, for a patient without an indication, because they run an even greater risk of developing this condition of priapism. And finally, a very common question: can Tadalafil stop working? Yes, folks, it can stop working. The body can become desensitized to the use of Tadalafil, hence the issue of its routine use in gyms. Other causes of Tadalafil's loss of effect include the underlying disease, which may become more severe, the dose that may not be having the same effect, which may require an adjustment, or some psychogenic effects of dependence on Tadalafil over time. So, this is a very important topic that comes up frequently in our routine. Therefore, talk to your urologist if you have this problem, because it can certainly improve your quality of life significantly. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.